ACCUPLACER Next Generation Arithmetic Questions.
Question 1. How are crutch tips placed for a stable standing position? Option A. Replace the tip before the crutch is used. Option B. Leave about 2 to 3 finger widths. Option C. Place them slightly forward and to the sides of the feet. Option D. Support weight through the hands rather than the axilla. The correct answer is option C. Place them slightly forward and to the sides of the feet. A wide base improves balance. Safe work in positioning and transfer depends on this point. Movement should stop when balance, strength, pain, or equipment safety becomes uncertain. Alternatives that continue movement despite weakness, resistance, or unsafe equipment do not meet the standard in the stem. Question 2. Which description is associated with hepatomegaly? Option A. The study of blood and blood-minus forming tissues. Option B. Enlargement of the liver. Option C. Surgical removal of the appendix. Option D. Related to the eye.
The correct answer is option B, 10.
Hepatomegaly refers to an abnormal increase in the size of the liver. The key consideration in medical terminology is that accepted word parts and clinical definitions determine the precise meaning. Those alternatives apply the term to the wrong anatomical or clinical concept, which makes them unsuitable. Question 3. The patient becomes light-headed after repeated deep breaths. What should the medical assistant do? Option A. Have the patient resume normal breathing and remain seated safely. Option B. Side-to-side comparison helps identify asymmetry. Option C. Reduce excessive room light as directed and use a focused light source. Option D. Seat the patient with the head turned slightly away from the ear being examined. The correct answer is option A. Have the patient resume normal breathing and remain seated safely. Hyperventilation can cause dizziness and requires a pause. In diagnostic testing, manufacturer instructions and the approved sequence should guide every procedural step. Choices that use an improvised setup, ignore poor tolerance, or accept technically unreliable data are unsafe or inaccurate here.
Stressed about your Illinois real estate exam? We can take Illinois real estate exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 4. A centrifuge vibrates violently. What should the medical assistant do? Option A. Record the date, service performed, result, and next due date. Option B. Stop it safely and remove it from use until evaluated. Option C. Compare and adjust a device to a known standard. Option D. Follow the manufacturer's instructions for use. The correct answer is option B. Stop it safely and remove it from use until evaluated. Continuing use can cause injury and specimen damage. The safety standard for laboratory quality control is that expired materials, failed controls, damaged equipment, or skipped steps can invalidate testing. The other choices release a result before required quality checks are satisfactory. Question 5. A patient reports an allergy to chlorhexidine. What should the medical assistant do? Option A. Document the intake and contact the provider or laboratory for instructions. Option B. Use the approved alternative antiseptic and document the allergy. Option C. Arrange prompt provider evaluation according to office procedure. Option D. Release it once blood flow is established and before removing the needle. The correct answer is option B. Use the approved alternative antiseptic and document the allergy. Antiseptic selection must account for patient hypersensitivity. For this medication administration task, the assistant should not change the dose, timing, route, formulation, or device instructions independently. This excludes responses that treat familiarity with the medication as a substitute for the required checks. Question 6. A patient has followed a new diet for 1 month. What response supports progress? Option A. Reinforce success and discuss strategies for difficult situations. Option B. Share only information authorized and necessary for transportation. Option C. Some plans require authorization or a designated network specialist. Option D. People experience and express loss differently. The correct answer is option A. Reinforce success and discuss strategies for difficult situations. Action requires skills and encouragement. The safety standard for nutrition and wellness teaching is that practical substitutions are more useful than vague restrictions or unsupported promises. Choices that do not address the nutrient, behavior, barrier, or health goal named in the STEM are unsafe or inaccurate here. Question 7. What is required before taking a wound photograph? Option A. Use a sterile applicator according to the ordered technique. Option B. Document undermining using a clock-face reference when directed. Option C. Obtain authorization and use the approved secure process. Option D. Use a consistent method and record dimensions in centimeters. The correct answer is option C. Obtain authorization and use the approved secure process. Wound images are part of the protected medical record. Consistent insurance processing requires the following: denials, overpayments, and claim corrections require a traceable, compliant response. Responses that use outdated plan information for the service being arranged do not fit the facts given. Question 8. What does a chemical indicator on a sterilization package show? Option A. It prevents the arm from crossing over the sterile contents. Option B. They prompt early source control before clinical staff interaction. Option C. They can harbor organisms and interfere with effective hand hygiene. Option D. It shows that the package was exposed to one or more process conditions. The correct answer is option D. It shows that the package was exposed to one or more process conditions. A color change alone does not prove sterility. The color change confirms exposure to specified processing conditions, but it does not establish that every microorganism was destroyed. Only the full sterilization process, required monitoring, and intact package support safe use of the contents.
Are you looking for ACCUPLACER exam actual questions? Visit our website pokerexams.com to access ACCUPLACER exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get ACCUPLACER exam answer key today.
Question 9. Which device is best for measuring a small oral liquid dose? Option A. Use an oral syringe marked in the prescribed unit. Option B. Do not crush it unless an authorized source confirms it is safe. Option C. Place it under the tongue and allow it to dissolve. Option D. Hold the dose and alert the provider for safe-route assessment. The correct answer is option A. Use an oral syringe marked in the prescribed unit. Oral syringes are more accurate than household spoons. The safety standard for medication administration is that allergies, contraindications, unclear orders, swallowing problems, or an unlabeled product must be resolved before the dose is given. The distractors give a dose despite unresolved swallowing difficulty, conflicting information, or an unclear product, so they do not address the question correctly. Question 10. What are damages? Option A. The required standard of care was not met. Option B. The breach directly contributed to the patient's injury. Option C. A professional obligation existed to provide a standard level of care. Option D. They are the actual losses or injuries resulting from the event. The correct answer is option D. They are the actual losses or injuries resulting from the event. Without harm, a negligence claim may lack damages. The key consideration in law, ethics, and scope of practice is that uncertain legal or safety concerns should be escalated through the designated supervisory process. Choices that conceal a concern instead of documenting and escalating it are unsafe or inaccurate here. Question 11. What should the patient do between prescribed puffs? Option A. Breath holding allows more medication to settle in the airways. Option B. Prime it exactly as described in the manufacturer's instructions. Option C. Wait the recommended interval and follow the medication instructions. Option D. Rinse the mouth and spit out the water. The correct answer is option C. Wait the recommended interval and follow the medication instructions. Spacing can improve delivery and depends on the product. The relevant medication administration principle is that safe administration requires a valid order, patient-specific verification, route-specific technique, and complete documentation. Alternatives that improvise the formulation, device step, administration route, or schedule do not meet the standard in the STEM. Question 12. The pain persists and the patient is diaphoretic. What should occur? Option A. Call emergency medical services according to protocol. Option B. Assign clear roles and use closed-loop communication. Option C. Advise against self-transport and use emergency medical services. Option D. Clear nearby hazards and protect the head. The correct answer is option A. Call emergency medical services according to protocol. Persistent high-risk symptoms require transport and advanced care. This emergency response item relies on one standard: the response must stay within training while protecting airway, breathing, circulation, and the patient from further harm. Alternatives that delay activation, provide unsafe food or fluids, or continue routine office work do not meet the standard in the STEM. Question 13. A patient asks the office not to share information with a family member. What should occur? Option A. No, access requires a job-related need. Option B. Follow the law governing that service and parental access. Option C. Document and honor the request unless another legal basis permits disclosure. Option D. Avoid elevators, hallways, and other public areas where unauthorized people may hear. The correct answer is option C. Document and honor the request unless another legal basis permits disclosure. Patients can limit involvement of others. A central rule in privacy and confidentiality is that minimum-necessary access, valid authorization, and identity verification limit unnecessary exposure. Those alternatives treat curiosity, convenience, or a personal relationship as authorization, which makes them unsuitable. Question 14. Should the medical assistant shout? Option A. Document the interpreter's identity or service and language used. Option B. Record objective statements, actions taken, and the outcome. Option C. No, speak clearly at a normal or slightly lower pitch. Option D. Use a calm tone and acknowledge the frustration. The correct answer is option C. No, speak clearly at a normal or slightly lower pitch. Shouting distorts speech and may not improve hearing. Consistent accessible communication requires the following: the patient should be addressed directly through the communication method or assistance they prefer. The remaining choices exclude the patient from communication with a companion or interpreter. Question 15. Before using a new cleaning chemical, what should the medical assistant do? Option A. Avoid aggressive squeezing or harsh chemicals. Option B. Review the label, SDS, required PPE, and dilution instructions. Option C. Activate the safety feature and discard it without recapping. Option D. Remove contaminated clothing and flush the skin according to the SDS. The correct answer is option B. Review the label, SDS, required PPE, and dilution instructions. Safe use depends on product-specific directions. The safety standard for workplace safety is that approved controls, labels, safety data, protective equipment, and prompt reporting reduce occupational exposure. Options that ignore label instructions, safety data, or engineering controls fail the principle being tested. Question 16. The patient says a previously listed drug was stopped by another clinician. What should the medical assistant do? Option A. Document the report without judgment and explore barriers within the assigned role. Option B. Record the known information and flag the missing dose and frequency for verification. Option C. Include prescription drugs, over-the-counter products, vitamins, and supplements. Option D. Document who stopped it if known and send the discrepancy for provider review. The correct answer is option D. Document who stopped it if known and send the discrepancy for provider review. Medication changes should be verified and reconciled by the responsible clinician. The safety standard for infection prevention is that clean and contaminated items must remain separated throughout care and reprocessing. Options that mix clean and contaminated items or rely on protective equipment without hand hygiene fail the principle being tested. Question 17. Which disease process often produces fatigue, cold intolerance, constipation, and slowed metabolism? Option A. Otitis media. Option B. Herpes zoster. Option C. Hypothyroidism. Option D. Hypotension.
The correct answer is option A, $58.80.
The combination of fatigue, cold intolerance, constipation, and slowed metabolism forms the characteristic pattern described in the STEM. The key consideration in disease-pattern recognition is that recognition depends on the characteristic cluster rather than a single nonspecific complaint. The other choices match only one nonspecific symptom and not the full presentation. Question 18. What type of infection is treated with an antifungal medication? Option A. A fungal infection such as candidiasis. Option B. they treat susceptible bacterial infections. Option C. It has accepted medical use but high misuse potential and no routine refills under federal rules. Option D. It lowers blood glucose by promoting cellular uptake and storage. The correct answer is option A. A fungal infection such as candidiasis. Antifungals target fungi rather than bacteria. Consistent medication administration requires the following: safe administration requires a valid order, patient-specific verification, route-specific technique, and complete documentation. Choices that bypass identification, allergy, order, dose, route, timing, or documentation checks are unsafe or inaccurate here. Stressed about your non-medical assistant exam? We can take non-medical assistant exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. What is coinsurance? Option A. It is the amount the insured pays before the plan begins paying covered costs under its rules. Option B. It is the amount paid to maintain coverage. Option C. It caps the member's covered cost sharing for the plan period. Option D. It is the patient's percentage of the allowed charge after applicable plan rules. The correct answer is option D. It is the patient's percentage of the allowed charge after applicable plan rules. Coinsurance differs from a fixed copay. Insurance processing should follow this rule. Insurance details should be verified for the patient, plan, date, and service involved. The distractors treat verification as a guarantee or overlook authorization, network, or documentation requirements, so they do not address the question correctly. Question 20. A patient asks what the kidneys does. Which response is accurate? Option A. It contributes fluid to semen. Option B. Conducts air from the larynx toward the bronchi. Option C. Filter blood and regulate fluid, electrolyte, and acid-base balance. Option D. Produce ova and reproductive hormones. The correct answer is option C. Filter blood and regulate fluid, electrolyte, and acid-base balance. The kidneys remove metabolic waste while helping maintain fluid, electrolyte, and acid-base balance. A central rule in anatomy and physiology is that normal structure and normal function must be considered together. This excludes responses that confuse anatomical location with physiologic function. Question 21. For an adult tympanic temperature, how should the ear be positioned? Option A. Use an age-appropriate faces pain scale. Option B. A record rhythm and strength. Option C. Use a validated behavioral pain assessment tool. Option D. Pull the pinna up and back before inserting the probe gently. The correct answer is option D. Pull the pinna up and back before inserting the probe gently. Straightening the adult ear canal improves probe alignment toward the tympanic membrane. Temperature measurement should follow this rule. The selected site and timing must be appropriate for the patient and the device. Responses that compare values without accounting for the route or recent intake do not fit the facts given. Question 22. The patient is talking and moving during the tracing. What should the medical assistant do? Option A. Wear comfortable clothing and supportive walking shoes. Option B. Ask the patient to relax, remain still, and avoid talking. Option C. Inspect the corresponding electrode and cable connection. Option D. Use a site symmetrical with the right arm electrode. The correct answer is option B. Ask the patient to relax, remain still, and avoid talking. Reducing movement improves signal quality. The safety standard for electrocardiography is that correct settings, lead placement, skin contact, artifact control, and patient cooperation are required for a usable tracing. Any responses that assign a diagnosis instead of documenting and reporting the tracing and patient response would be inappropriate. Question 23. Which reminder detail is important for a fasting procedure? Option A. Include approved preparation instructions or direct the patient to them. Option B. Use an approved translated or interpreter supported process. Option C. Confirm the patient's communication preference and consent under policy. Option D. Use a neutral office name, appointment time, and callback number. The correct answer is option A. Include approved preparation instructions or direct the patient to them. Incomplete preparation can require cancellation. A central rule in scheduling and message handling is that scheduling changes should protect continuity, privacy and realistic use of staff time. The remaining choices promise availability or clinical advice beyond the assistant's authority. Question 24. What should occur immediately after swabbing? Option A. Avoid touching the tongue, cheeks, or teeth. Option B. Place the swab into the correct transport system and label it. Option C. Document the medication and inform the provider. Option D. Ask the patient to breathe slowly through the mouth and say ah. The correct answer is option B. Place the swab into the correct transport system and label it. Proper transport preserves organism viability. The key consideration in specimen handling is that container choice, collection method, labeling, storage, timing, and transport determine whether the sample is usable. Any responses that use the wrong container, timing, storage condition, or collection method would be inappropriate. Question 25. How can fibers support bowel regularity? Option A. A rapid increase can cause gas and cramping. Option B. It helps identify due vaccines and prevents unnecessary duplication. Option C. It supports collagen formation. Option D. It adds bulk and helps retain water in stool. The correct answer is option D. It adds bulk and helps retain water in stool. Fiber can promote easier passage. In nutrition and wellness teaching should connect the recommended food or behavior with the stated health goal. This excludes responses that do not address the nutrient, behavior, barrier, or health goal named in the STEM.